And it was a very, very successful meeting. Dr. Todi and the same team did this meeting last 10 years ago, and now we are coming back to Kolkata after 10 years. Now what we have during this meeting, it's over 5 days. The first 2 days we do workshops, and here we have 14 workshops, and each workshop anywhere between 60 to 100 delegates are there who are trained in various, not theory but skills. And we have demonstrations and a lot of things. So a lot of workforce across the country is coming for this conference and getting trained in these 14 workshops. One special workshop that we are conducting is for the lay public. We are doing a workshop on basic life support. And today almost 250 lay persons have been trained in basic life support skills. And this includes the police force, students and various other people. The society has taken the initiative to give complimentary training to these 250 people. So 2 days we will have workshops. After that we will have 3 days of the conference. During this conference, almost morning from 9 to 5, we have various scientific deliberations. We have faculty, 23 international faculty that have come from different parts of the world, all leaders in the field in their subject, and also many faculty who have come from the Southeast Asian countries, along with the national experts in the subject. This, I would say, is the largest meeting of critical care in the country. So this meeting, we have close to 2,500 delegates are attending this conference. So it will be a great exchange of knowledge sharing, where we can share our expertise, the latest research, and also interact with the delegates and get their interactive sessions and get their feedback on various aspects of critical care medicine. We have done it third time.
First was 1999.
In 99,
second
then we did
it was 2013.
And now we are doing it in 2024. So third time in Kolkata. So we wanted to do in big metro cities.
टाइम गैप क्यों है?
कलकत्ता में करने का इतना टाइम गैप क्यों है?
के लिए इतना टाइम गैप क्यों है?
ऐसी बात नहीं है. It goes to different cities.
Okay.
Different cities they bid for it, and then we select depending upon the infrastructure. So many cities have yet not. They have done it the first time also. But Kolkata, because it was very popular, all the times by popular demand we have in Kolkata, and because it's a very special year, we wanted to come back to Kolkata.
आप बोले थे यहाँ पे स्टूडेंट लोग
जो कॉन्फ्रेंस है वो सिर्फ डॉक्टर्स के लिए है और जो क्रिटिकल केयर करते हैं, लेकिन ये जो स्पेशल हमने वर्कशॉप किया है 250 लोगों के लिए, वो ले पब्लिक के हैं. तो कोई भी अडल्ट आ सकता है, कोई भी जो जॉब कर रहा है, आप एज रिपोर्टर्स कैन कम. सॉरी,
फ्री ऑफ कॉस्ट.
दिस इज टोटली फ्री ऑफ कॉस्ट. इट इज एन इनिशिएटिव so that, because whenever there is a patient, a person who collapses on the road or in a bus or a train or something, there is no doctor at that time. It is a lay public who is there. So it's very important for us to train the lay public in basic life support. Of course, afterwards they will bring the person to the hospital. But at least to train the lay public, it is really important, and that is why ISCCM has taken this initiative to save lives. More lives.
Which type of critical care?
No, when you are in intensive care, so we are all intensive care doctors. So when you are in ICU, you know the ICU. So you need to be taken care of it by a doctor who is trained in ICU. Very few doctors are trained in ICU in our country. So our main job is to train doctors in ICU. So that is what we are trying.
As on date, how many doctors are there in your
association? The membership, it is close to almost 18,000.
It's to membership?
Yes, to membership, yeah, close to going up to 18,000. We have life members, we have also associate life members, we have international members, and also members from the Southeast Asian countries are members, yeah.
So these 18,000 countries all over the world, globally?
Sorry?
18,000 doctors.
Yeah, they are from all countries, mostly from India, but also from other countries.
Which country attending this year?
Which country?
Yes.
Most of the delegates are from India, but we also have some delegates from Southeast Asian countries.
Southeast Asian
And
countries.
a few other countries also. Yeah.
What is major disease?
Critical illness.
Critical
So
disease.
if you see, we have a lot of tropical dengue, malaria, and tuberculosis, and these kind of patients, when they get very sick and need ICU care, this is unique to the Indian subcontinent. So we have expertise in managing these conditions, which are not seen so much in the developing world.
So have you any platform for the district level to grow the consciousness?
Sorry,
In
to
the district
Yeah.
level.
meeting that we have once a year in the month of February. But other than that, through the entire year, ISCCM engages in teaching and training activities. After COVID, especially, we have started a lot of online platforms, so that even people in the remotest of places who cannot reach these kind of big meetings can be trained. So we have bi-weekly, twice a week, we have interactive sessions which ISCCM runs free of charge for the members, not only for the doctors but we also have for nurses, and people can join and they can listen to live lectures and also have interaction with the expert faculty. So it doesn't matter where you stay in the country, once you're a member you can join and you can learn and gain knowledge in critical care medicine.
Tell them about city branches.
Yeah.
We have
The other thing which is a big achievement for us is we have 100 city branches.
100.
Yeah. So in this year, in the 30th year, we have made the 100th branch. So ISCCM operates through the city branches. So the city branches also run their activities. They are at city level, district level, smaller places also have the branches. So that is our big strength because we run our activities through the branches and these branches reach out to all the doctors in that region. So they are able to cover a lot of area through the branches. We are able to run a lot of educational activities. So that is one of our strengths because having so many branches, we can run a lot of activities. And branches are actively involved.
In Kolkata, Howrah and Siliguri. 3 cities.
And these branches are only increasing because different people, we only need 10 members to form a branch. So every time we form a new branch, that area develops and critical care medicine in that area, they keep having meetings, workshops, conferences. So the education spreads in that manner.
Tell me, have you
Liaison with the pharma industry. They have their own research agenda and all that. They come to us and ask us whether this molecule is going to work in a patient or not. And we do advise on that.
In addition to that, we
addition-
also have what we call trials or studies that are done. So there are a lot of clinical research happens in the intensive care unit where many drugs are tested and we can know about the beneficial effects of one over the other. So a lot of research is also happening in new molecules, especially in critical care patients.
in the multi-center trial of worldwide trial,
Studies,
and
yeah.
many centers are actively involved in that.
So
study.
ISCCM is also conducting its own research and a lot of studies are ongoing. In addition to that, we also collaborate with other societies of critical care medicine in Europe and United States, America, etc. and do multi-center studies so that we can do collaborative research.
We are publishing Index journal, which has been very popular.
We have a journal also called Indian Journal of Critical Care Medicine, which is published every month. This comes out, and this is also an index journal, so it is online and it is read internationally, articles. And just recently we got in journal this thing, it's called impact factor, so we got an impact factor of 2, which is really good, and that happened in this year. So that has our research and our studies also are read across the globe through this. We also have a newsletter. Dr. Pradip Bhattacharya is the editor of that, and that is like the comes out every 2 months, and all the information related to the society and our activities, etc., is disseminated to the members. It's also available free online for people to read, so people get a lot of information about our activities.
Regarding expansion, what is the plan for the northern region or the southern region? Because people are patients are more there, right?
Yeah. So we have 100 branches. So we have branches from all regions. We have not only branches, we have zones. We have 6 zones: north, south, east, west, central zone. And last year we started a new zone called the special zone for northeast. And we have also started various outreach programs to reach out to people in the hilly areas. And recently we had one in Shillong, which was attended by more than 250 delegates, where rather than them coming to these meetings, we go and do an outreach program. We've had one in Jammu as well, and there we also trained almost 100 police personnel, again in basic life support in Shillong. So ISCCM is trying to reach out not only to the places, but the smallest of more remotest of places where we can spread the knowledge and training of critical care medicine. And one of our other projects is to impart education not only in India, but we are collaborating with many of the Southeast Asian countries are looking at India and ISCCM as a training this thing. So we have the Indian Diploma of Critical Care Medicine, but now we have started the overseas IDCCM. So many countries like Bangladesh, Sri Lanka, other Southeast Asian countries are looking to India and ISCCM to impart knowledge and training in critical care medicine. So this is an initiative that we have undertaken.
চব্বিশ পরগনা যেটা বলছো যে ওটা what you asked চব্বিশ পরগনা and south of হ্যাঁ তো রিজন ওখানে যারাই ক্রিটিক্যাল কেয়ার প্র্যাকটিস করছে দে হ্যাভ টু অ্যাপ্লাই দ্যাট উই ওয়ান্ট টু স্টার্ট এ ব্রাঞ্চ and we have at least 10 members who are actively practicing critical care. Once they apply, we give them the recognition. So this is the process what we are following. So currently, none of them, if you disseminate this message to 24 Pargana area, obviously the people who are practicing critical care, they will be interested to apply for this society's membership, and then they will
any branch to form a branch, even in the remotest of places, needs only 10 ICU doctors. That's all that's required. And then we have always seen that it starts with 10, but critical care medicine develops in that region. Educational activities start. The center gives a lot of support to these branches, and that way there's only progress.
And lots of benefits are there. It is not only making after a branch is made, we see that regular activities are being conducted for the society, for the community, society, for the discipline itself, for other disciplines also, and all these things, awareness program, to the way we are doing it for police personnel here, so for laymen, so we monitor all those from the center. So once they open the branch, all these things will automatically start happening under the instruction of center.
আচ্ছা লেম্যানের কতক্ষণ ট্রেনিং টাইম লাগে যে লেম্যান
এখন দেখুন বেসিক হচ্ছে যে হাউ টু সেভ এ লাইফ, এখন যেটা আমরা ট্রেনিং দিচ্ছি হাউ টু সেভ এ লাইফ, তো 6 ঘন্টার ট্রেনিং অনেক কিছু শিখে যায় ইফ দে প্র্যাকটিস ইট। কেন কি একবার শিখে দিলে তো হয় না, সাইকেল যদি চালাতে শেখায় তো আমরা চাপতে শিখিয়ে দিয়ে একবার প্যাডেল মারতে শিখে যাই, কিন্তু আস্তে আস্তে ওকে নিজেই চালাতে হবে। সেরকমভাবে এই বিএলএসটাগুলো প্র্যাকটিস করতে হয়।
খালি 6 ঘন্টাতে বলছি কাজ মিটে যাবে?
হ্যাঁ 6 ঘন্টা ট্রেনিং দেওয়াতে অনেক যথেষ্ট, ওইটাকে ওকে প্র্যাকটিস করতে হবে।
সেটাকে মেনলি হার্টের ক্ষেত্রে বলছেন না?
হার্টের ক্ষেত্রে হার্ট অ্যাটাক ওইটা হচ্ছে সব মানে ওয়ান অফ দ্য কমনেস্ট প্রবলেম,
যেটা বুকে চাপ দিয়ে করে সেটাই। আচ্ছা আচ্ছা
Heart stop ho jata hai and the life
থাকে না,
stop.
দীঘাতে লাইফ গার্ড আছে, সুইমিং পুলে লাইফ গার্ড।
Yeah, when the heart stop. One more thing I want to tell you is every year we have a theme and some kind of social listening. So this year it is prevent, treat, defeat sepsis. So every year it's something different. So sepsis is infection and it's a big killer, and many patients with sepsis are there in the ICU. So this whatever the theme is, every year we use this theme to disseminate the information not only to doctors but also to lay public, training lay public. So this year we have been able to train a lot of doctors across the country and also reached out to lay persons through the branches, through these 100 branches. We have been able to conduct activities to impart knowledge about sepsis, how to wash your hands, basic things about infection, how to get the patients to the hospital early, how to monitor, how to know that somebody is sick, if someone elderly is at home. So all this information is imparted to the lay public, and we have started many initiatives like this. So every year there is a different theme, and we use this theme to promote knowledge not only to the doctors but also to the lay public, which will be useful in preventing various conditions.
আমাদের বেঙ্গলে কত আপনি ক্রিটিক্যাল কেয়ার ডাক্তার আছেন?
বেঙ্গলে প্রায় 700
অনলি 700
মেম্বার যারা আছে,
নন মেম্বারও তো আছেন?
বাকি প্র্যাকটিস করছে কিন্তু মেম্বার নয়, হয়তো আছে ওরা।
Actually, to become a member,
How many non-medical person are joined in this conference, 3-day conference?
So today, as I mentioned, we had it's a conference is only for doctors, for ICU doctors, but today we had a workshop for basic life support, which was for lay public. So anybody could join.
Sir,
And
in
we
West
got basic
Bengal,
life support.
in every district, government has opened medical colleges and also in sub-division levels. So, do you think that curricula in the MBBS and
questions. We have been discussing that because in our curriculum there is no such critical care. When we passed out MBBS. Even during our post-graduation, we didn't have any critical care. But subsequently, when there is demand, you will get the supply. So every district, not only district, sub-town, you will get the nursing home or smaller hospital where there is ITU of 4, 5, 6 beds. We didn't have any trained critical care person. I'm not talking about the specialist. You want to become a member when you have got a postgraduate degree. But many of our doctors, they are very good and trained critical care doctors, but they might not have a postgraduate degree. So number may be not too much, but in West Bengal there are a lot of doctors. Even I am sure in Calcutta at least 1,000 doctors are working on critical care with a good quality, providing good quality service to our patients. And our responsibility is to train them so that they can provide that service to all the patients who are in the periphery.
So do you think there are enough?
MCI already, but for the knowledge of the all of you, Indian Society of Critical Care Medicine having an academic branch, and that's known as Indian College of Critical Care Medicine. This Indian College of Critical Care Medicine runs the 3 courses throughout the country, and they are for the post MBBS, post PG, and these courses are helping. And these are by your training of these courses. At the time of the COVID, the country did not face the kind of the problem which the other countries faced. It is because the contribution given by the training provided by Indian College of Critical Care Medicine, that's an academic branch of the society, which is going on for the last so many years.
Like I mentioned, even before we had this curriculum in the universities, Indian Society of Critical Care Medicine was already giving diplomas in critical care medicine. So critical care medicine was not recognized as a specialty by the medical council, the then Medical Council of India. But ISCCM was already running the process. So we trained thousands of people in critical care medicine, giving them diplomas by the society, not from a university. And this served us very good during COVID time because we really had a shortage of ICU doctors and we really needed this workshops. So the people that were trained by ISCCM, they were really helping in a big way and working during the COVID time.
As you asked that, critical care in India is mainly 80% is in private sector. ICU training is less in the public sector. So now we require more public-private partnership. So even the government of West Bengal, they are approaching us as a visiting professor in medical college to teach their students. And that even in the district level, ICUs are opening up. So I think we require more public-private partnership because ICUs are still concentrated mostly in the private sector hospitals. So we require more input into the public sector.
Patients are exponentially increasing day by day. Boys বাড়ছে তাহলে বয়সে and এখন আমাদের যে longevity বেড়ে গেছে ইন্ডিয়ান পপুলেশনে দেখুন আগে 56 বছর ছিল এখন 66 বছর হয়ে গেছে তো যত বয়স বাড়বে তত এই ক্রিটিক্যাল ইলনেসও বাড়বে
আচ্ছা আপনাদের
কিন্তু অল্প বয়সী ছেলেদের দেখেছেন কিভাবে হার্ট অ্যাটাকে মরে যাচ্ছে অল্প বয়সী ছেলেরা
Trauma is the biggest killer in India.
অল্প বয়সী ছেলেরা দেখেছেন কিভাবে হার্ট অ্যাটাকে মারা যাচ্ছে অল্প বয়সী মানুষরা
অল্প বয়সী অনেক মারা যায় এখন ইন্ডিয়াতে এখন আস্তে আস্তে এই জিনিসগুলো আইডেন্টিফাইও হচ্ছে আর ইনসিডেন্সও বাড়ছে তো তার জন্য সব থেকে বড় রেসপন্সিবল ফ্যাক্টরস আপনারা তো জানেন হার্টের ডাক্তাররা বলে যে লাইফস্টাইল চেঞ্জ হয়ে গেছে খাওয়া দাওয়া চেঞ্জ হয়ে গেছে হ্যাঁ these are the most important factors which is causing but there are many genetic factors also so lots of research is going on as far as the cause of this premature heart attack or premature diseases which usually not used to be diagnosed previously or 5-10 years back when the diagnostic facilities were not so advanced আজকাল অনেক কিছু ডায়াগনোজ হচ্ছে কেন কি ইনস্ট্রুমেন্ট চলে এসেছে তার জন্য তো এগুলো ফ্যাক্টর হচ্ছে অনেক রকম জিনিস আছে
Also trauma is the largest killer in India. We have very high incidence of trauma. So these patients who have road traffic accidents, they come into the intensive care unit. And like he said, a big burden of infectious disease, which is also seasonal. It also depends, we have a big load in the ICU during the monsoon season and other seasons. So
when ICU patients are increasing in that,
metropolitan city 40% of the beds are of intensive care all critical care patients are kept in 40% beds আপনি জিজ্ঞেস করুন
but of course not every patient has to come into